It is 8:11 now. Louisiana has the third highest breast cancer death rate in the country. And black women younger than 50 are twice as likely to die from the disease than white women. Today, we're learning about the latest statistics involving black female breast cancer patients. Dr. Kevin Stevens is joining us this morning. Thank you so much for being with us. I'm glad we're having this conversation, of course, in October for Breast Cancer Awareness Month. There is a huge disparity when it comes to race in the breast cancer outcomes.
Yes, and I think part of it is because of the diagnosis. So many times we are later in the diagnosis, and many times the resistance and hesitancy of doctors and healthcare providers, that plays a role in this process.
Wow. Okay, so let's talk about some of the most common forms of what we're seeing.
Well, the most common form is what we call ductal carcinoma, and that's pretty much easily palpated. Many times it's late in the disease for sure. You can get lymph nodes, you can have a discharge from your nipple. Those are kind of things that you can do. So definitely, if you feel a lymph node or bump somewhere, make sure you get it checked out. But more importantly, get your mammogram. And a lot of people, they just don't get mammograms.
What age are you supposed to start that?
Well, you should start at least when you're 50. And
Okay.
if you have a family history, a mother, a daughter, a sister, something, then you may want to get it done a little sooner.
Sure, and of course the stage at which you're diagnosed is so important.
And that's so important, that's right. The earlier the diagnosis, you can get a lumpectomy and node dissection. If it's late in diagnosis, you have to have flaps and all kinds of things that you have to do. And the laws are very specific about breast cancer that you can get plastic surgery and those kind of things by law is mandated.
Oh, nice. Okay, yeah, which is very helpful for women who've gone through this.
Yes.
Let's talk about one of the positive. The death rates have actually dropped overall for the past 2 decades, I understand.
Well, we have had a lot. Thank you so much for talking about this. Even this morning, just awareness, making people, I can remember one of my good friends, I was saying, look, you should get your screening for it. He said he told his wife, and she had carcinoma in situ on her breast. He did a mammogram. And we were just talking on the phone.
Yeah.
He said, I'm going to tell my wife to go get a mammogram. And so talking does make a difference.
Wow.
So just if you haven't gotten your mammogram, please go do it.
Sure, and then let's talk about some of the changes you can make, because I know you stressed a healthy lifestyle in prevention.
Yeah, and it's all diet. That's half of it. What you eat, fats. And, if you look at all those things like don't smoke, and you look at eating fruits and veggies, 5 fruits and veggies a day, exercising, we say about 150 minutes a week. All those if you do all 4, you have a reduction in cancer, you have healthy life and healthy lifestyle. So we need to really look at our community, make sure we start walking, we start eating fresh fruits. They call it farm to table, that's great, you know, and eating less meat and eating more fruits and veggies.
All right, so some simple things we can all do to prevent this. And then when it comes to that disparity, is the biggest part awareness as well?
Yeah, and it's all, and our African-American community, I don't think it's genetics, I think it's more the environment. The environment is what you do, where you live. We call it social determinants of health.
Right, we talked about that a lot during the pandemic.
Yeah, absolutely. So we have to
access
really,
to health care insurance, access to a doctor, access to healthy food that you're talking about eating.
And information, health literacy. So we have to, it makes a difference.
All right, well, hopefully this conversation helps someone today. Dr. Stevens, thank you for being with us.